A new survey shows that as COVID-19 cases rise throughout the country, many senior citizens are planning to take the COVID vaccine once it's made available to them, but they're still concerned about the perceived cost and potential side effects. Joining us with more insight on the COVID-19 vaccine is Richard Ashworth. He's spent his career focused on improving the health and well-being of others. Good morning.
Good morning.
So let's talk about this survey. A majority of senior citizens are saying that they are ready, that they do plan to get the COVID vaccine.
Yeah, who we asked this survey of was senior citizens, those that are Medicare eligible and are part of our Silver Sneakers program. So for most 65 plus, they're aware of what Silver Sneakers is. It's a well improvement program that helps seniors get physically fit and socially connected. So we help them get a free gym membership and to, get digitally connected with one another. And when we come back from COVID, back together in their communities. And that's who we asked. And what they said was, yes, 85% of them do intend to take the vaccine at some point. However, half of them said not right away. So they want to wait just a little bit. And there's kind of two main reasons for that we saw in the survey. One, and this one surprised me because I'm a pharmacist by training that spent my whole career working in retail pharmacy, is they're worried about cost. And all of the information we see around Medicare beneficiaries is that the cost of the vaccine will be nothing. And so 62% of them were worried about that. And then 36% of that 60% said, if there is one though, if there is a cost, that's going to significantly impact their ability or desire to get the vaccine.
Oh, wow. That's very interesting. But yeah, cost is obviously a big concern, especially if they're on a fixed income and things like that. That's why it's important to get some of the right information out there. Do you feel that this rollout of a COVID-19 vaccine is going to present any additional challenges for our senior citizens?
Yeah, another one is, if 85% are intending to take the vaccine, that means 15% are not. And when we asked the 15% why they would not take an approved COVID-19 vaccine, the number one reason was side effects. They're worried about the side effects of the vaccine, either getting the shot itself or what it may mean to them and their health conditions. And so there's good news on both these fronts, on the pay and cost side, and then also on the side effect side. According to the CDC, the side effects from the COVID-19 vaccine are very similar to those that partake in the flu vaccine. Good news there, 86% of our Silver Sneakers members take the flu vaccine every year at their local pharmacy or doctor's office. And so I think once people start to see, that the vaccine is rolling and they're seeing, testimonials and information from seniors who have taken the vaccine and showing that the side effects are pretty low and that the cost was zero, I think that'll really help. I think one other point to make is that you got to go to trusted places to get information. There's just so much information out in the market now that sometimes it can be confusing.
Yeah, so where can they go for this important information, for factual information about the vaccine? What do you suggest?
Well, we asked them, and luckily what they said is exactly what I would have told them, so I'm happy to report it. So we asked them on the non-government side, where do you go to get trusted information for COVID and for the vaccine? And they said three places: their doctor's office, their health plan, and their pharmacist. So I'm really encouraged by that because that is a fantastic place to go to get good clinical information and to get logistics information, right? Where's the vaccine going to be available and how much is it going to cost? Nothing in this case. On the other side, we asked them on the government side, where do you go? And they said they go to the CDC, the FDA, and the NIH. So great. Three fantastic places for transparent, accurate, and reliable information. So that's telling me that this population of seniors is not only experienced, but pretty smart too, because they're going to the right places to get credible information.
Yeah, that's good news. Do you have a call to action for seniors as well as healthcare and government leaders?
Yeah, for the seniors, it's ask all those questions because you have the right to. And if you have those questions, make sure they get asked. My advice, though, is ask that question, but go to one of those trusted resources to get the answer. And then once you do that, take the vaccine because our seniors will see that the clinical information, the logistics information, and the adoption information says that this vaccine is safe and effective. And so you should take it. On the healthcare leader side or government side, it's more about transparency. Trust is so important here for different populations of our seniors and the whole country to want to adopt the vaccine, really quickly. The clinical side is one track super important. Pharma and our institutions like the FDA and the CDC have been working hard to make sure that this becomes available and that it's safe and effective. Then you have logistics, right? I've been in retail pharmacy my whole career. They've got them on every corner in America. 90-something% of Americans live within 2-3 miles of a retail pharmacy. All of our independent pharmacies and chains, it's great. Plus you have doctor's office and fantastic health systems. Great place to get the vaccine. But third is adoption. So are you willing to take the vaccine? And there are different groups, socioeconomic groups, demographic, cultural, religious, all different kinds of backgrounds that I think make it important for us to get local so that we can drive the right information to get the action to take the vaccine.
All right. Well, you're helping get the word out. Thanks for joining us this morning with that information. If you want to learn more on the COVID-19 vaccine survey, you can visit tivityhealth.com/vaccine study.